Welcome to this episode of Jeevans Diabetes and Endocrine Center, JDEC Vimala Health Talks. My name is Dr. Jeevan Joseph. I am a consultant endocrinologist and the director of Jeevans Diabetes and Endocrine Center at Vimala.Hospital, Ettumanoor, Kottayam. In this episode, we are going to talk on something which is very topical and also of great interest to all of you, which is diabetes and COVID, what every person with diabetes should be aware of. When you think about somebody who has diabetes in the current scenario of people landing up with COVID infections, the question that comes first to your mind, I'm sure, is what are the chances do I have a higher chance of picking up coronavirus infection if I have diabetes? And let me start with the good news. The chances of your picking up coronavirus infection if you do have diabetes is not higher than anybody in the general population. So that's good news for people with diabetes. The important thing that you need to recognize is that if you do have diabetes and if you are unfortunately COVID positive, then the chances of your developing a more severe version of the COVID infection is more likely in your case. And that's the whole reason that we are doing this health talk. So the other thing that we need to understand is that diabetes is of two types, type 1 diabetes and type 2 diabetes. Now, most of the information that we have from China and from Italy seems to suggest that if you are a type 1 diabetic under the age of 25 years, then the chances of your having a severe infection with COVID are not higher. So this is good news for people who are young, who have type 1 diabetes, which is treated with insulin in young age, etc. They don't have a higher severity of developing a severe version of COVID if they do get coronavirus infection. But most of the higher risk of having a more severe infection is in type 2 diabetic people who have the adult form of diabetes. And what are the reasons for this? The reasons are manifold, but predominantly it is because people with type 2 diabetes tend to be older. And we know that older people have a higher risk of having a more severe version of COVID. So clearly, if you're more than 65 years, you have a higher risk of developing a more severe version of COVID. Secondly, people who are men, male age is a slightly higher risk of having a more severe version. If you are a diabetic and if you have uncontrolled problems like heart disease, kidney disease, etc., this can also impact why you might develop a more severe version of the coronavirus infection. So these are some of the reasons why it's important for people with type 2 diabetes and people with uncontrolled diabetes to be aware of this, not to be scared, but to be aware of this when they go around, when they walk around. So this is about understanding your risk. The second part of this talk is about what you can do to deal with that risk. How can you mitigate that risk? How can you plan ahead? And here, the public health guidance that is available for all people applies even more stringently for people with diabetes, which is that you need to wash your hands frequently with soap and water for at least 20 seconds. You need to make sure that you maintain physical distancing of at least 2 meters. Don't land up in crowded places. Try to avoid places which are crowded. And don't try to venture out of your house unless it is absolutely necessary, especially if you're in the risk groups of being on the older side in terms of age, you have other medical complications. So all those guidances have to be followed by people with diabetes, and it's very important for people with diabetes to follow that guidance. Secondly, if you have diabetes, you need to make sure that your diabetes is well controlled, because we know that uncontrolled diabetes is one of the reasons why you can have a more severe version of the coronavirus infection. So how do you know whether your diabetes is well controlled? You need to check what is called glycosylated hemoglobin, which is a simple blood test called HbA1c. It is an average of the blood sugars that you've run over the last 3 months. So if you have an HbA1c around 7% or less, then this means that you have a much better chance of not having a severe version of COVID if you're unfortunate to pick up the coronavirus infection. So it's very important that you check your glycosylated hemoglobin, check your HbA1c, and if it's not well controlled, make sure that you see your doctor to ensure that your diabetes treatment is appropriately optimized so that you can get good glycemic control. When you check your blood sugars, you make sure that your fasting blood sugars run between 100 to 110, and your 2-hour blood tests after your meals, your blood sugars are around 140. This will ensure that your diabetes is under good control. Now, if you are unfortunate to pick up the coronavirus infection in spite of all these precautions that you've taken, and that is likely, that is a possibility that we can't rule out, then clearly we need to understand that there are two possibilities. One is that you have diabetes and you've picked up the coronavirus infection, but you have a very mild version of it. And this is equally possible. And if you have asymptomatic coronavirus COVID infection, or if you have mildly symptomatic coronavirus infection, what should you do if you have diabetes? In terms of managing your diabetes, make sure that you take your regular medications regularly as prescribed. Don't miss them. Make sure your diabetes is well controlled, which means you follow all the sick day rules, which is that you drink plenty of fluids, make sure that you're not dehydrated, check your blood sugars very regularly, and make sure that they run between around 110 to 180, which is a good kind of range when you are running an infection. And how often do you need to check? If you are an insulin treated person, if you're using insulin for treating your diabetes, I would suggest check your blood sugars every 6 hours. And if you are not using insulin, then perhaps check them every 12 hours and make sure that your blood sugars remain between 110 to 180 at all times. And hopefully the infection will just resolve by itself and your diabetes will be stable during that period. If unfortunately you have a more severe version of COVID, which requires you to be hospitalized or requires you to be getting medical input in hospital, then clearly your doctor who is managing your care is likely to stop all your diabetes tablets and manage your diabetes during that period with insulin, which is what we tend to do in any case when patients who have any kind of infection who are treated in hospital, we tend to use insulin for that period. And I'm sure that your doctor who's treating you will advise you appropriately for that period. So in summary, it's important to recognize that having diabetes does not increase your risk of developing or catching coronavirus infection, but it does leave you at a slightly increased risk of having a more severe version of it if you get the infection. It's important that you can mitigate that risk by following all the public health guidance and also by making sure that your diabetes is under good control. And finally, I will end by pointing out the red flag signs, the danger signs that any person with diabetes who has any kind of infection should be aware of. And if you do have any of those danger signs, then you should be seeking immediate medical help. And those danger signs are blood glucose, which is extremely fluctuant, blood glucose less than 70, greater than 250. If you have acid in the urine, or if your urine ketones, the urine test is called urine ketones, if they are positive, if you feel very tired, lethargic, if your conscious levels are low, if you're continuously vomiting, you're unable to keep food down, etc. These are the kind of danger signs, red flag signs, which no diabetic person should ignore. And if you do have any of these signs, you should seek immediate medical help. So with appropriate knowledge, empowering yourself, you can make sure that even during these COVID times, you don't need to be overtly worried and you can have a healthy, good life. Thank you very much.